The following recording has been created by Youth Out Loud and supported by Healthwatch Kingston. It has been funded by the Royal Borough of Kingston upon Thames Resilience Fund.
Hello and welcome. My name's Scott. I'm from Healthwatch Kingston and Youth Out Loud. I'm joined today by Isabella. Isabella, how are you?
I'm good, how are you?
Yes, I'm very well, thank you. So we're recording a podcast on access to NHS and social care services for young people living with a disability. Also, this recording is sort of talking through our findings. We use some of Healthwatch's previous knowledge. So obviously over the years we collect information from the public, their experiences. So we've got a few that we already had. We interviewed 3 parents and 1 young person, which they'll all be available on your web shortly. We had a survey around access, so asking people for their access, what's been good, what's not. We got 27 responses, which included when we went out to Orchard Hill College and the Xavier Centre at Richard Challoner. So thank you very much to those that were part of the interview, fed back to our survey, obviously to the school and college for having us, and obviously over the years anyone that's given us their feedback, their experience. First thing, obviously we learned about is obviously issues around diagnosis and treatment. It can take quite a long time for people to get a sort of full diagnosis. So, and their parents saying they have to push. So I don't know if you can remember anything that we learned from the interviews that you were a part of.
I think one of the biggest problems that was raised about having a delayed diagnosis is that for many services, you can't actually get any support until you have a formal diagnosis, as that's a requirement for the services. So a lot of the time, that means that someone might be missing out on treatment that they need because they don't have enough evidence to suggest that they need it, even though they do need it. And then, as a consequence of that, people's medical conditions might get worse over time if they're just not being supported in the same way. And ultimately, it just puts more pressure on the NHS if by the time they finally are seen, things have got worse and they could have been prevented from doing that had there been an earlier diagnosis.
True. If we had sort of a suggestion or recommendation could be to anyone really, what would it be based on what we've learned around obviously it taking a long time?
I think we can't change that things are going to take a long time because there's just a lot of pressure on the NHS. And unfortunately, that's kind of how it is at the moment, and it's going to take a lot to change that. But given the current situation, one thing that individuals can do is try and chase up start the process for diagnosis as soon as possible. Because even if it turns out there's nothing wrong, you haven't really lost that much. But if something is wrong and you've identified it early and tried to seek help for it at an earlier stage, you can get help for it earlier. So it's better to start things sooner rather than later.
Yeah, I agree actually. So for parents, carers, if you're unsure, try and seek that support. If you think it might be a diagnosis, pushing for that as well. Another thing we heard is around sort of dual diagnosis or being an issue, and obviously other things that are happening in people's lives, making it tricky. We heard that obviously one young person who was a young carer and has a diagnosis of autism, but actually before the diagnosis of autism came in, people thought their behaviour was due to the fact that they were a young carer rather than anything else. And we also had an issue, which was an interview you were part of, around sort of treatment. And if you can remember that one about the horse riding.
Yes, so there was one young person we spoke to who mentioned that as part of her condition, she sometimes gets pain in her feet, but also has problems with balance and coordination. And she was told that as a result of the pain in her feet, it would be really good if she did some horse riding to get rid of the pain or at least minimize it. But the problem was that horse riding was a very unrealistic solution for her as a result of the balance problems. So I think something as a result of that would be quite helpful is if healthcare professionals, when assessing what the best treatment option is for someone, looks at the whole picture. If someone had looked at her whole medical history, they would have seen, oh, anything requiring a lot of balance probably isn't going to be suitable. Let's suggest something different instead of giving her a suggestion that she could never actually do without an alternative. So I think if people look at the whole picture, then that would give a higher chance of having treatments that work for individuals.
Definitely, definitely. The other thing in terms of diagnosis and treatment that we sort of learned, there's lots of medical professionals get involved, and you get passed from one to another, and then people saying they have to keep sort of retelling their story. Any comments on that one, Isabella?
Yeah, I think it's very unfair that people have to keep retelling their story because not only does it waste appointment time itself, but it also creates the additional problem of how do you know that you're going to remember everything each time you're speaking to someone? Because if there is quite a complicated and complex medical issue, you're not necessarily going to remember every little detail each time and tell people. And that can lead to suggestions of treatments that might not work as best as they could for people, as we saw earlier with the horse riding.
Hmm.
So it's definitely not ideal for people to have to keep retelling things. But something that could help is if there was some kind of database or better track of records for all NHS services, because I'm not sure if there currently is one, just so that medical professionals can keep track of records from all aspects of a patient's care rather than just their care under that individual professional, if that makes sense.
It does. It does. It's something we definitely ask. Speaking of sort of specialists and of medical professionals, another thing that was raised is obviously when they have to travel to specialist services, it can be quite exhausting. It's a few hours there, a few hours back. And obviously it involves a bit of time off school and work. So I don't know if you've got any comments on that subject. Obviously, the time people have to take off and the pressures on them to get there.
Yeah, I think that sadly, in the case of a lot of these appointments, you can't really avoid that you're going to have to take time off for them
Mm.
because the working hours of the healthcare practices are going to be the same as it during the working week. So that clash is somewhat inevitable. And we can't change that they're likely to be far away either, just because if it is a very, very specialized and niche service, you're not realistically going to be able to have one in every small town. So
No.
you are going to need to travel for it. But one thing that people can change is how everyone looks at the situation. So whether that's employers, teachers, or people in power, just looking at someone's situation with a bit more understanding and understanding, okay, they're going to have to take time off for this. I'm not going to get annoyed with them or make it seem like it's their fault because really it isn't. So I think just a bit of understanding from people could hopefully make a bit of a difference there.
Would you extend that to people that are seeking a diagnosis? Because that's something we heard from someone is that whilst sort of the GPs and the specialists are figuring out the diagnosis, as I said earlier, it opens up to sort of different treatments. But we've heard about a school that was sort of chasing attendance for someone that actually was going through the process of trying to receive a diagnosis. And actually, during that time, it was questioned, why you're not in school. But actually, there was a really valid reason. They were trying, they were struggling, and they were trying to get to a point where they had a diagnosis.
Especially, yeah, I would say that is worth doing because someone can then say in the previous situation that under the Equalities Act, because they might be having to go to a lot of health appointments as a result of a disability, they can say, oh, well, if you're not making reasonable adjustments, that doesn't go with the Equalities Act. Whereas because there's no official diagnosis, the same thing doesn't apply there. There's no legal
Mm.
protections. So I think, especially in this case, understanding is needed because otherwise nothing is going to get done. But obviously, they need to be taking that time off.
Mm.
So I think raising awareness that sometimes in life, some people might have to take time off to get a diagnosis of something, and that's okay, and just normalizing it in a way.
Yeah. The next sort of discussion point we spoke about is carers. One of the things we learned is that the threshold for the extra support is high. We've heard that some people are going through an assessment and being told actually not qualifying for the extra support. When we spoke to young people around access to NHS social care, as long as the GPs, the dentists were happy, they were really happy. As long as the GPs and dentists were kind and nice and caring, that's what they really wanted. But what we learned is that sort of into the sort of early 20s, mid 20s, is that parents were still the ones taking them to these appointments, even some young people who were living sort of independently with obviously support, it was still parents that were doing it. So obviously that might lead to a small pressure on the families. And obviously as families get older, at some point, parents may not be able to do that anymore. So that whole situation around some people, some families, they're not getting the carers because the threshold is they're not seen as needing it, and then for others, it's still the family that are organising the appointment. So I don't know if you've from our discussions from the interviews, whether you've got any comments on the issue around receiving the extra care.
Yeah, I think it's not fair that families should have to be providing extra support because it should ultimately be down to carers to do it. But obviously, the NHS is very stretched and just doesn't have the funding for it. So sadly, I think it is a case of hope that there's more funding available because that is the real issue at the moment. There just isn't the funding available for it.
One of the things that we did hear, one of the people we interviewed, their role is to sort of match people with carers, and they're saying there is a shortage of carers. So people who have a budget sometimes can't get a carer, and there is the risk that they could lose that budget. I know they can put forward their case that they've tried, and there just isn't the support available. And that's what we were told. But they're saying there's people who are not getting it, and then there's people who do get a budget and then they can't find support. One of the reasons potentially they gave is the amount people get paid to do the work, which can include personal care. And obviously some people who need that care can be verbally abrupt and abusive. It's not the nicest of work conditions. So it's sort of that's what their belief is to why we're not retaining staff. It's potentially for the money, not worth it, is what they've said. Don't want to make it all about money, because obviously we've spoken to some carers and the care workforce well-being thing, and actually they absolutely loved being carers. But obviously if that's suggested as the reason people are leaving or not staying or not taking on roles, then it is something to be looked at. So the next discussion is sort of the transition we spoke about is from child to adult services. What we learned, what we got told, is they don't always change over at the same time. So you'll be in some, if you're in multiple services, some of them you're still in child services, some of you in adult services. And the other is the adult services do not offer the same amount of appointments. So I think you were with that for that interview, if you can remember what was said.
Yeah, I can remember. So some services change whether you're an adult or a child at 16 and some 18. And one of the people we spoke to said that it was quite confusing because sometimes you're an adult, sometimes you're a child. It's not really clear which one. So I think all services should have the same cutoff point because that just makes sense. So that there's more consistency across services. But also, I think it's sadly as inevitable as a lack of NHS funding that children's services, which receive more funding than adult services, are able to give you more regular appointments. Whereas it was suggested by one of the people that we spoke to that adult services only give you an appointment when you need the help specifically. So it's less regular and sort of a as you need it case rather than constant support. So I don't think we can change that just as a result of funding, but I think one thing that could change is a smoother transition process. So the frequency of the regular appointments that someone would go to as a child between the ages of 16 could decrease so that by the time they get to 18, they're in the full adult situation, because that just makes things easier for everyone to understand and process.
Yeah, and the other thing that was mentioned is the person we spoke to got diagnosed sort of mid-teens, slightly later. So they wouldn't have had the extra appointments that you get in child services. It's sort of a small amount of time with that, and then suddenly into adult services with less.
I completely agree that that is a problem, and perhaps, again, it would depend on funding available. But perhaps, regardless of the age of someone, if someone got regular appointments for, let's say, the first year since diagnosis or something, that could really help people just to give them the support earlier on when they haven't had it so that they can sort of adjust to things.
Another thing that was mentioned to us is about changing places, which, for those who don't know, they are sort of facilities for people who need a bed and a hoist, a bit more room. So sometimes these places can get two staff. And obviously, if you need that facility, it requires you to plan your day around it. So if you do have appointments, obviously you have to travel to specialists, or if you end up in unfortunately end up in urgent care, it's knowing where these are so you can plan your day. And the other thing, obviously, around physical access for those who need those facilities, it might be a lift as well, which again doesn't necessarily come under the NHS social care. But if you're trying to travel from one area to another, then sometimes quite far, if lifts aren't working and there's no changing places, it makes it very challenging and sometimes impossible to sort of get places and also to be there comfortably. I don't know if you have any comments on that. I don't know if you've seen there's a website which does list them, so you can um see where they are, but then that requires that to be up to date.
I think that one good thing that has been done over the last few years is that I think a law was passed to state that any new buildings above a certain size must be built with a changing places toilet in, which I think is a really positive development.
Hmm.
It's a shame that it only applies to new buildings, as some areas of the country have more new buildings than others. So older, more established towns might not benefit as much from this. But I think it's still a step in the right direction. And expecting people to be able to renovate old buildings to put them in is unfortunately unrealistic. But hopefully, as time passes and more new buildings are built, things will become more accessible for people. And on the topic of lifts, again, it's not necessarily something that falls directly under health and social care, but I think something that would be a good thing to encourage people to do is if a lift is broken, then fix it. It sounds really silly,
Yeah.
but there are lots of lifts that are just they don't work and it doesn't look like anyone's ever going to get around to fixing them. So just fixing them would make a big difference.
Yeah, it's not my lived experience, but I can't imagine the sort of dread of knowing that there's going to be a good chance that the lift you need is still not fixed. The recommendations, obviously, or the suggestions, obviously, in simply just fix the lift. And obviously, as we move forward, more changing places because it's sometimes from previous experience, my old job, I know they can be quite far apart, and it's obviously just planning that day becomes so much easier if there are more of them available to you. A final thing, we spoke to someone around having a sort of a temporary disability. This was around after sort of medical procedure left someone with, and it's regular medical procedures every few years. Sort of the mobility sort of drops off, legs in casts, and become a wheelchair user for a short amount of time. I don't know if you remember the issues they had around sort of the logistical issues around hiring the wheelchair.
Yeah, so this person was told that in order to get a wheelchair for her son to use, she had to drive to two places which weren't particularly close to her. And one thing she raised was that even though it was quite annoying to travel there, it wasn't too bad because at least she drives and could access the places. But if you're trying to access them by public transport, it's a lot more complicated because they're not always the closest places and it can take a very long time. And one thing she raised was, well, why can't they just give out the wheelchairs in a hospital? And I think it would make a lot of sense if the wheelchair suppliers were able to drop them off to hospitals because in this case, at least they were still able to get the wheelchair because the boy's mother could drive. But if it's just an individual that lives alone and can't walk, I think it's a bit absurd to expect them to be able to travel somewhere independently to pick up a wheelchair. And ideally, you'll be in hospital if you're in that situation. Why can't you just receive the wheelchair there? It would just make a lot more sense because they're not going to have to make a journey that they can't make. And that's where they're going to start needing to use it. So they may as well get it as soon as they can rather than having to wait an excessive amount of time.
The last thing that was mentioned with this situation is a temporary blue badge. You know, the blue badge parking spaces, they're wider, they're closer to the place that you're probably going to. But what they did is they'll park in the blue badge space, get the sun out, and then go park somewhere else. And actually, if they had the blue badge, they could just stay in that space and use it. But what was raised by someone else is where is the line? So if you have a sporting injury and you're left with the same situation of not being able to your legs are in casts temporarily and you're in a wheelchair. Have you got any thoughts on that? About where would the line be? A suggestion of where the line could be?
I think it's a very good point to raise that blue badges should be considered to be opened up to other people because if you are in full costs for 8 weeks and a wheelchair user, you just can't park in a normal space for 8 weeks. So I think in that case, it's very clear that if a blue badge did exist, temporary blue badge did exist, then it would be worth granting it to someone because in order to get someone adult sized out of a car and into a wheelchair, you do need that additional space. That's kind of unavoidable. But yeah, as you were saying, I think there are problems with opening up to a lot of people, unfortunately. I think that if you did give a temporary blue badge for any injury that affects mobility, that's probably going to be quite a lot of temporary blue badge users. And there just aren't enough blue badge parking spaces for that to be realistic. And then it means that by the time someone who is in a wheelchair, for example, goes there, but the space is taken up by someone with a sporting injury who still has mobility, it's just limited, but they could have probably got away with parking in a normal space. It just makes things more difficult for the people who really, really need it. So I think it's definitely difficult to decide where exactly that line should be drawn, but it would definitely be beneficial for some individuals to have a temporary blue badge, especially if they know in advance that they're going to need it for a certain amount of weeks.
Thank you. There's more on your web, there will be more on your web, but those are our sort of main sort of learnings from what we found out, what we heard. Isabella, I just want to thank you again for your time today and also the interviews you were part of.
Youth Out Loud is a group of young people helping to improve our local health and care services. We work with Healthwatch Kingston and we use our voices to make health and care services better for young people.